Let's talk about video SEO for doctors. And when we discuss video SEO, we're actually discussing a hybrid of two terms. Video speaks for itself, and SEO is that very often used word. We mean actually optimizing your content and your website for the search engines. In actual fact, it's optimizing for Google most of the time. So optimizing your content for Google combined with video, that's what brings us to video SEO. So video SEO is about making use of two things. One is the fact that Google owns YouTube. So YouTube is actually Google and vice versa. It's one and the same company. So it means that a YouTube video item is really interesting for Google because it's just another way of presenting information to the user, the consumer who has been typing a search request into the Google search engine. So as your patients are looking into specific information, bariatric surgery, orthopedic surgery, fertility treatment, as they are doing these searches, they actually have an option to not just stay with copy and read up on content, but to go straight to the videos that are available on that specific topic. So let me show you what actually that means, and as a result, what happens to the patient's click behavior. So as I type fertility specialist Perth in Western Australia, the results I get when I use the video tab are all videos. So I can now select any video that discusses a topic related to fertility treatment, IVF, or a specific fertility clinic or fertility specialist in that local catchment area. So how can you, as a doctor, make use of that? Let me first show you another example. As we do bariatric surgery, same location, same catchment area, we click on the video tab. As a consumer, we just get an opportunity to look at local video content presented by local bariatric surgeons in that area. So there's a few things you can do as a surgeon, as a specialist, to make use of this. And the first thing is obviously to produce video content, making sure that your video content is available and palatable in short snippets. So don't do a 35-minute presentation then hoping for that to bring in more patients. Make short 2-3 minute videos and label them really well on your YouTube channel. So Google/YouTube knows what they're about. If you're a fertility specialist, you want the right keywords to be in that video title and in the YouTube description, which is what we've done. And by the way, the examples I've shown you are all customers, digital practice customers, who have actually been able to be on page 1 of the video search results. So anyone in that local catchment area typing a specific search into Google or YouTube will find our customers and will get familiar with the surgeons, get to know them, and build rapport. Because that's the other thing. This is not just about being found. Let me show you what else is involved. As patients browse the content and get to the landing pages of the website, for example, the one about weight loss surgery here, the videos are properly embedded on that page. And so what happens is that patients who decide to click on the video and watch the surgeon explain one of these aspects, well, again, they spend more time with you as a surgeon, as a specialist, and they're not spending it anywhere else. So they're spending time with you, they get to know you, you're building rapport, and you're one step closer to getting a new patient, because trust is obviously one of the key elements as patients are practicing their ability to choose. They are browsing content, they are listening and watching, they are making up their mind, and in that process, video makes a huge difference. So, two things: video is good for your SEO, it makes you more visible in the videos tab of the search results, and number 2, it keeps patients on your website pages for longer, builds trust, builds rapport, and brings you one step closer to gaining a new patient.